And many parents likely struggling with how to talk to their kids about all of these children dying in Texas and how to navigate conversations about their mental health. A child psychiatrist with Prisma Health says parents need to create a safe space to talk with their kids, and they need to put aside all distractions when having those conversations. Parents should also ask their kids for permission to talk about what happened.
For the most part, as it relates to human development, human beings don't really understand that death is permanent till about 5 to 7 years of age. So there's this window of time that for the younger kids, they may be exposed to the news story, they may understand that you're very, as the parent, upset about it, but they may not understand the full scope of the process or the tragedy. And that's okay, and you don't have to indoctrinate them or educate them to that degree. You can keep it easy, you can keep it light, you can keep it superficial, but the bottom line is create that safe space for them to answer the questions. The adolescents, you're gonna have to talk to them directly, and you're gonna wanna frame that conversation like you would with a peer. They're developmentally gonna be much more able to communicate exactly what they're thinking and exactly what their fears are or concerns about the circumstance might be.
He goes on to say it's important for a parent to process their emotions about the shooting with perhaps their spouse, other adult loved ones, or friends before even talking to their children.
We often talk about the idea that it's very important for parents to put their own oxygen mask on first, just like in the airplane, before they try to put their child's. So if you're an adult, you're a parent, and you're struggling with this event, and you're struggling with the tragedy, and you're feeling those intense feelings of anxiety or distress, it's very important that you first address those feelings in yourself by seeking meaningful interpersonal interaction with your spouse, your partner, your friends, your adult family members before engaging with your child. And if that's not sufficient, or if you don't have access to those resources, then seek community resources to support you in counseling, mental health, and processing the trauma.
Well, he also adds you should try to limit your child's exposure to tragic news coverage if they're young, and you are able to control how much they watch, including making sure you are not watching news coverage when they are in the room.